We are going to be discussing on our topic today is on posture. Now, before we move to posture, naturally the human body has been structured with bones, joints, and muscles to allow for movement in different directions. Whenever the body prepares to perform a movement, it positions itself in preparation for that particular type of movement. That position in which the body is positioning itself is known as posture. Now let us start. Before we start today's class, at least at the end of this class, you should be able to explain the meaning of posture and describe the types of posture we have. And also, we are going to be able to demonstrate the kinds of posture. Some of the kinds of posture, like the sitting, standing, walking, and lifting posture. Now, what is posture? Posture can be defined as the way the whole body is being carried or assumes position during the performance of an activity. These activities include walking, sitting, lying, jumping, running, dancing, climbing, and lifting. That is the normal our daily activities, the way we carry our body during our daily activities is what is known as posture. Now, factors that influence posture. Now, we have the following are factors that influence posture. We have the first one as age. Now, what do you mean by age? That is either the young or old. Either you are young or old, it can also affect your posture. We also have number 2 as habit. Bad or good postural habits will also influence the posture, either good way or bad. Number 3 is nutrition. Long-standing nutritional deficiencies or inadequate diet will also determine your posture. Next one is injury. Accidents affecting the backbone, that is vertebral column or limbs, can also influence the posture of an individual. We have the next one as occupation. Occupation, that is long sitting, standing, or bending in the workplace. All this lead to fatigue. That is, we have different types of occupation. There are some people in their, like the bankers, an example, they do sit for long period. So all this can also affect the posture. It can influence the posture of an individual. The next one is heredity. That is inherited hunchback or weak back. There are some people that inherit this hunchback from their offspring, their parents. So this is also influence the posture of an individual. And the last one, which is the clothes. The clothing in which, that is any form of dresses, trousers, knickers, shorts, shirts, or blouses which restrict movement of the limbs, trunks, or head affect good posture. That is, when you are putting on clothes that is restricting movement in any part of the body, can also influence your posture. Now we move to the next one, that is the description of posture. Now, what are the description of posture? Posture can be described as either good or bad. That is, we have two types of posture, the good posture and the bad posture. Now, good posture is the proper carriage of the body in accordance to the human anatomical makeup. This is known as good carriage or ideal carriage. That is, when you are carrying the body in the proper anatomical way, that is when it is said to be a good posture. We have the benefits of good posture. That is, good posture is important because 1, it aligns bones and joints for effective use of muscles, strengthens the muscles of the chest to give a firm support to the lungs and the heart when breathing and pumping blood respectively. It also strengthens abdominal muscles which keep the intestinal walls in a correct position. Decrease the wearing of joint surfaces, decrease stress on the spine, thus reducing chances of spine fixation. Promote efficient performance of all the body systems, ensure self-confidence and positive image. And the last one, which is encourage efficiency and flexibility. That is, it encourages flexibility in the parts of the body. Factors that promote good postures are 1, the body carriage, that is good body carriage habits in all body movement. When you carry your body in a good way, so it promotes good posture. We have the next one as exercise. Regular exercise that benefits the whole body is also essential for good posture. Good diet. Adequate diet with sufficient nutrients for the body is also essential for good posture. And adequate rest. Number 4, adequate rest. Rest the bones and muscles after rigorous activities. That is, after your daily activities, you rest your muscles and your bones in a proper way. The next one is good health habits. Do not abuse substances. Take only prescribed drugs to maintain personal hygiene and avoid diseases. That is, good health habits, you should not abuse the substances like the drugs, like those that normally take hard drugs. So it is not good for the posture. Next one is immunization. Complete scheduled immunization, especially polio and tuberculosis vaccination. That is, you should complete the complete scheduled immunization, especially the polio and tuberculosis vaccination. The last one, early detection of disease. Go for prompt medical treatment to prevent postural defects. Now we move to the next one, which is the next type of posture, which is bad posture. Bad posture is when the body is carried in the wrong way. It is also called bad carriage. Now the effects of bad posture on the individual are unattractive appearance, breathing difficulties, poor muscle development, sluggish walk or walking with gaiters, that is covering the lower leg, poor blood circulation in the body, unnecessary fatigue, and low self-esteem and lack of self-confidence. Now we move to the last topic for today, which is the kinds of posture. As you can see, the following are the common posture. That is, we have different types of posture, and we have some images to describe the best way of this posture. Now the first one is kinds of posture, that is the standing. As you can see, the middle man is standing upright. So this middle picture is the right position for standing. The next one is sitting posture. You can see when you are sitting, you should make your two legs, your 2 foot should be flat-footed on the ground. Unlike the other one, you can see the other side. That is bad posture. You can see the good posture. The one marked correct is a good posture, and the one with cross sign is the what? Bad posture of sitting. Correct sitting position. The next one is walking posture. You can see walking and running. So when you are walking, you should always follow these habits. Not that when you are walking, don't raise your head too high, nor bring down the head downward. So you should make sure the head is aligning straight to where you are going. And the next one is lifting posture. That is, how do we lift? Now you can see the first set pictures. They are the wrong way of lifting. And the next set is the right way of lifting. And this will also remind me about those of us that we normally have carry loads. Like for instance, if you are fetching water, most especially the guys, they like to carry loads on one of the hands. So it is better you try to balance it. Make sure you are when you are fetching your water, you carry the water with 2 hands, or you look for a bucket that you look for 2 buckets, so that you are going to be accurate. The next one is the lying position. That is, how do we sleep? Good sleeping position. You can see the good sleeping position and the bad sitting position. Bad sleeping position, sorry. So emulate the right one and avoid the bad set of sleeping. So in our next class, we are going to be learning about the postural defects. So in the next class, We are going to be learning about postural defects, so sit tight and always make sure stay safe away from any danger. Thank you very much.